Read any number of MRI reports or journal articles and you'll see that subscapularis tears are rather prevalent. Yet I'm not sure these findings are replicated in ultrasound for a couple of reasons. The first thing to appreciate with subscapularis is the complexity of the anatomy. It's a large, multi-pennate muscle as demonstrated with this MRI, and this is not appreciated on ultrasound. The most common mistake sonographers make when assessing subscapularis is they externally rotate the arm too much. They drop down too low and they take this image, which shows the anterior shoulder joint capsule and a small part of the subscap tendon, which is nowhere near the enthesis and nowhere near where the majority of these tears will occur. As I stressed in our anatomical concept section, we need to be able to identify the enthesis. And there are a couple of tricks to do this with subscapularis. The first is to use very slight external rotation, just 10 to 15 degrees of the arm. And from this image, if we're scanning a left shoulder with the patient facing us, we want to rotate the probe in a clockwise direction, just 10 to 15 degrees. We fall off the biceps and onto the most superior and first facet of subscapularis. If it's the right shoulder, we rotate 10 to 15 degrees in an anti-clockwise direction. This is where the majority of subscapularis tears will occur. Here we can see a partial thickness tear of subscapularis, and with using the aforementioned technique, we can see a higher grade tear of subscapularis. Subscapularis tears are difficult, however. This is an MRI that shows a partial thickness tear of subscapularis, and this is the corresponding ultrasound. Yes, there is some irregularity of the enthesis, but it's not a well-demarcated hypoechoic or anechoic cleft. This case, if nothing else, illustrates just how difficult shoulder ultrasound can be. I still maintain that shoulder ultrasounds are the most difficult MSK examination that we perform, but far too many view ultrasound simply as a means to assess for bursitis and impingement, whatever that is. The intricacies of the anatomy and pathology are often overlooked and underappreciated. Thanks for listening, guys. Like and subscribe for more content.